All right, so let's talk about vital signs. So chapter 10 is about vital signs. So we have a range of vital signs here. Unfortunately, textbooks tend to vary on what they consider normal versus abnormal vital signs. So I'll tell you kind of what I've seen as the most common listed normal and abnormal. Typically, when we see in terms of testing, that number is going to be grossly or a lot different than the normal range. So temperature, your book says that a normal temperature in Fahrenheit is 96.4 to 99.1. Fever, we typically think of happening at 100.4. Pulse then is 60 to 100, and that's determined in beats per minute. Respiratory rate is 12 to 20. It's the number of breaths per minute. Pulse ox is 92% plus. So typically your normal range is like 95 to 97. In the hospital, typically 92% or below is when we would apply oxygen depending on if somebody has COPD or not. And then with blood pressure, this is going to be over 95. So normal would be 95 over 60 plus or under 140 over 90. So in terms of your temperature, you're detecting the temperature within your body. Typically, if we're seeing an elevated temperature, it a lot of times is related to infection. So that's kind of one of the most common reasons we would see somebody have an elevated temperature, but that's not 100% of the time. There are some things like environmental conditions, somebody being out in the really hot sun for a while, or some medication adverse effects. So oral temperature, that is under the tongue. You can see over here in this picture on the right, to get that temperature for an oral temperature, you are going to stick the thermometer to the left or right side of the tongue. That's called the posterior sublingual pocket. That's the closest to the artery running to the vein. That's going to give you the best reading. Axillary is then under the armpit. This is traditionally 1 degree lower. Rectal is the most accurate then. I would say axillary is probably the least accurate. Rectal is the most accurate. Of course, this is very invasive, so we don't want to do this for everybody. But if you have somebody unconscious, a child, a younger child who can't hold the thermometer under their tongue, rectal is going to be the best indication of temperature. Temporal, to obtain this type of temperature, you have a probe and you're going to rub it across the forehead to behind the ear. That's going to go over that temporal artery and give you a nice non-invasive reading. So temporal across the forehead to behind the ear, and then tympanic membrane is the thermometer that goes within the ear. All right, in terms of vital signs, we have pulse. Your pulse is 60 to 100. Is normal. So when you're doing the pulse, it's measured in beats per minute. So BPM, that means beats per minute. The number is the number of the times the heart beats in 60 seconds. Okay, so we've got different areas you can measure. We'll talk about these in lab, but we have your radial pulse, which is on your wrist on the side of your thumb. Brachial, which is in your antecubital space, which is the space where your arm bends. Carotid, which is in your neck. Femoral, which is in the groin. Popliteal is behind the knee. Posterior tibialis is on the inside of the leg. You have kind of that sticky outy bone on your ankle. It's behind that. And then dorsalis pedis is on the top of your foot. So to count the pulse, you want to count the number of beats in 30 seconds and then multiply it by 2. If it is an abnormal pulse or it's irregular, you do want to count for an entire minute, so an entire 60 seconds. But if it feels regular, 30 seconds is enough. You'll just multiply by 2. Now, if you want to directly assess the heart beating and count the pulse that way, that is the most accurate pulse you can get. You're going to do the apical pulse. And so this is where your heart is the closest to your rib cage, so the closest to the outside of your body, and you can assess the heart rate, if the rhythm's regular or irregular. And so to locate your apical pulse, and try this at home, but you're going to go on the left side of your body, halfway across your clavicle, so we call that the mid-clavicular line, and you're going to go down 5 intercostal spaces, and the intercostal spaces are the spaces between your lungs, so you're going to go down 5 of those. So it's typically kind of right under the left nipple, but it's left intercostal, left midclavicular line, I'm sorry, fifth intercostal space is where you find that apical pulse. All right, in terms of vital signs, assessing the pulse, we are going to determine how often it happens, so how many beats per minute, and then we want to see if it's regular. So is it lub dub, lub dub, lub dub, or is it lub lub dub dub, like just irregular? And then the strength of the pulse. So the pulse strength ranges from 1 to 4 plus. 0 is going to be no pulse at all. That would be a concern. You would want to report that to the provider. 1 plus is a weak and thready pulse. It just may be low blood pressure. You're just not getting good circulation to whatever area of the body. 2 plus is normal and easily palpable. So that is a regular pulse. 3 plus is full, it's increased. 4 plus is strong and bounding. Maybe somebody's exercising, they had a bunch of caffeine, they took a med, and it's causing increased contraction of the heart. That would be your 4 plus. All right, so with your vital signs, respirations, the normal is 12 to 20. So again, you want to count for 30 seconds times 2 and multiply it by 2. So count for 30 seconds and multiply it by 2. And then don't tell the patient you're measuring. So if you are looking at your patient and they know you're counting their respirations, they will alter, even subconsciously alter how they're breathing. So you could do it maybe as you're listening to lung sounds, listen for your 30 seconds. But you'll multiply that by 2 to give you breaths per minute. Next one is pulse ox. I like to include this. I don't really think your book covers it a lot, but pulse ox it's a little probe, typically goes on the finger, and it detects the amount of oxygen in your arterial blood, so the percentage. Below 92%, we typically apply oxygen. You're going to see higher, maybe 95 to 97%. We can look in lab at each other's pulse oxes, but it's typically a little bit higher. But this assesses that percentage of oxygen in your arterial blood.